Tsai Ing-wen is known internationally for handling the COVID-19 outbreak in Taiwan extremely well. However, this is not actually the case. She used the COVID-19 outbreak for her own benefit in many ways. So the first thing that Tsai Ing-wen used COVID-19 for was to help her rig the 2020 presidential election. Due to the fact that there were an unconfirmed number of ballots already stuffed in the ballot boxes, and also due to the fact that the election staff could not be sure how many ballots they could actually steal during the counting process, an issue would occur where the total number of ballots for each candidate added up would probably not be equal to the number of ballots cast by actual voters. Therefore, the Central Election Commission dealt with this issue by removing the rule altogether. The election staff on January 11, 2020 was no longer required to declare the number of ballots cast by actual voters. This allowed them to stuff and steal as many ballots as they liked without keeping count of the total number of ballots. Therefore, there was no accountability between the election staff and the public.
社会秩序维护法。对，因为你有在网络上有不当的言论呐。对，然后我们有截图下来要麻烦你到我们派出所去说明一下这样子。
什么时候？
你 po 文的时间是108年12月19号的下午21点50分嘛？
是什么内容？
要我念给你听吗？
念。
坐票、监票、废票，太多绿奥博藏在每个步骤中选会今年改了规则，全换成新的绿支票所人员投完票不报出实领总票数，所以根本不知道总票共领了多少，空白票多少。内容大约是这样子你等于是在讲中选会的事情啊，这有侮辱到中选会这样有不当的言论这样所以要麻烦你要配合一下这样。
In this clip, we see here that the Central Election Commission is very concerned about people passing around articles criticizing the removal of this rule. They called it insulting the Central Election Commission and are trying to bring in this woman for questioning. In the following clip from the August 15th by-election in Kaohsiung, we see the election staff declaring how many ballots were cast.
1560领票数700。好。
大声一点不好听不到。对，一票。
This is the normal and proper procedure in Taiwan. However, on January 11th, the election staff skipped over this step and went straight to the ballot counting. You can see in this voting station in Taichung that when the counting process started, nobody declared the number of ballots cast by voters. They just started. You can hear that lady saying, 开始了. That's how we know that this is the beginning of the ballot counting process.
开票结果全部投票选举开票出会诊之后所那个的投开票的那个报告表为准目前的我们现在总计是这样的。那我们现在准备开始。
So the audio in this video is very poor, but you can see that the staff did not declare how many ballots were cast in this voting station before they started counting either. Due to the added pressure on the election staff to steal and stuff ballots, much of the election staff were afraid of being discovered by the general public for rigging the election. Therefore, the COVID outbreak in Wuhan in December 2019 gave them a reason to wear face masks on January 11th. Therefore, many of the election staff members could not be identified. Without risk of identification, psychologically the election staff would be more willing to complete the election fraud. Rigging the election was the very first thing that Tsai Ing-wen used COVID-19 for.
从1月底被征收开始其实我们现在的产能大概增加了3倍，从原本的50万片到150万片，但是我们的人力也调整，从20小时调整到24小时。其实从这一次的禁止出口到征收，从一开始的不理解到我的了解到佩服， 如果没有这么做，其实台湾人根本不会有口罩用。
所以对民众来讲的话，现在买口罩它其实是方便，他只要打开口罩地图，然后去看说它周边附近有哪些点，它的存量比较多，甚至他也不见得需要直接跑一趟，他可以直接在上面都有电话的资讯，他直接按一个按钮，甚至还不用输入电话，按一个按钮，他就是打到药局去问。所以其实可以帮民众省掉非常在寻找口罩的这些时间。
那我们将来要配送的时候，要用什么样的方式才能够精确，然后大家可以免除排队之苦。
很多民众会很焦虑，越买不到越焦虑，其实这就是人的心理嘛。当你越想要，而你越买不到的时候，你会发现你会落入一个恶性的循环。所以其实口罩实名制经由这样子的一个锁定每个人的一个购买状况，确实是针对社会现况的恐慌的这个程度来说，我觉得产生一个非常好的管控的效果。
These last two reports make it look like the government's mask requisition system or mask rationing system worked perfectly, as if limiting the number of masks an individual can buy per day, that they solved the problem. However, the truth is that between January and at least June 2020, it was very difficult to find masks inside pharmacies, convenience stores, and other stores that should normally sell face masks. They were either sold out, or if they were pharmacies, the government actually took their masks away. This is what these reports aren't reporting. The employees inside pharmacies were actually very angry at this time because the government took their masks away. Ordinary surgical masks were very difficult to purchase, and it was very common to see people waiting in line at clinics to get just a few masks that were allocated to them if they had a national insurance card. For myself, I had to go and purchase these more expensive masks at a nearby pharmacy. It was the regular surgical masks that were almost impossible to get everywhere. If you were out in this city and you didn't have a mask with you, there were many places you couldn't go into because they required a mask. However, it was almost impossible to buy a mask in Taipei City due to what the government was doing. Why was there a mask shortage in Taiwan when Taiwan's mask manufacturing capacity was clearly enough to cover the entire population?
对武汉肺炎的威胁，在全体国人的努力之下，国内的疫情得到了最好的控制，也更受到国际的瞩目跟肯定。那么我们也看到，台湾已经从过去的口罩进口国，转变成全球第2大的口罩生产国。口罩的日产量不断的向上突破，可以充分的供应我们国内的需求。所以，我们从下周4开始呢，国人每人每14天可以买成人口罩9片，或者儿童口罩10片。我们也制定了寄送口罩到国外的规定，协助在国外的国人做最好的防疫。
Now, countries around the world are reporting shortages of protective equipment like face masks, not only for medical staff, but also for ordinary people. But one country that's avoided this is Taiwan. So how do they do it? And could their approach be emulated by others?
While getting a mask can be no easy task in many parts of the world, it's another story here in Taiwan. To ensure the safety of its population of 23 million, Taiwan imposed an export ban on surgical masks as early as January. The government then began rationing masks to 3 per person per week, and soon after made them available online. Now Josie can place an order for face masks with an app. Purchase history is recorded by her national health insurance card so that it can be verified before sales. 10 days after placing the order, Josie picks up her surgical masks at a convenience store.
Following its pledge of 10 million masks to the U.S., Europe, and official allies, Taiwan has announced a second round of mask donations, and this time to Southeast Asia. A total of 1 million face masks will be donated to countries including Singapore, Malaysia, Myanmar, and the Philippines.
The government said it would consider sending masks to other countries, including Japan and South Korea, although neither country has contacted Taiwan about the matter. This latest pledge has reignited speculation about that the government had rationed masks to the general public in order to stockpile supplies for diplomatic use. Premier Su Tseng denied the charge on Tuesday. He said that masks were truly in short supply early on in the outbreak, and the mask-making industry had drastically scaled up capacity in a short period of time, enabling Taiwan to donate to countries in need.
A donation of 7 million made-in-Taiwan face masks arrived in Germany on Friday. They'll be distributed across Europe to numerous countries struggling to handle a flood of COVID-19 cases. Taiwan has now donated 10 million masks abroad, in line with the government's campaign to show that Taiwan can help.
Taiwan is small but great, solitary but independent, and has astonished the world with its response to COVID-19. The officials expressed gratitude for the donation and a wish for the WHO and the world to include Taiwan in global initiatives. Taiwan needs the world and the world needs Taiwan, he reportedly said. Xia wrote, "I was tearing up. I'm proud to be Taiwanese."
We are very grateful that Taiwan sent us 500,000 of face masks that will help us to overcome corona crisis. Thank you very much.
Taiwan now produces more than 15 million masks daily and aims for 20 soon, as the country vows to donate upwards of 10 million masks to countries around the world that are hardest hit by COVID-19.
So right now, under the regulation is, however many face masks we manufacture every day, we have to provide it to the government.
Okay.
Yeah, and they buy it from us. So it's not for free.
Okay. And the cost at which they buy it, it's obviously lower than normally, or it's the same?
For us, it's definitely lower than normally. Yeah. So right now, I would say they buy from us around 2.5 to 3 NT per piece, right? Normally, when I sell it, is well above that.
Yes.
Now, when face masks were first being sold in pharmacies and other places, they were limited to 3 per customer per day. This policy was all that was necessary to keep people from hoarding face masks. It definitely wasn't necessary to make people line up at clinics to pick up masks once per week. What they could have done, and what would seem like common sense to me, would be to overstock all of the places selling face masks. There was no reason that face masks couldn't be as readily available as toilet paper all over Taiwan, and put limits on how much each person could purchase per day. By overstocking Taiwan would have definitely had enough face masks early on. The Tsai Ing-wen administration was definitely more concerned with donating masks to the international community in order to win points. This was a clear sign that she cared more about what others thought of her as a national leader than what people in Taiwan thought of her. She has proven over and over that she doesn't actually care what people in Taiwan think. And why should she care what they think? She can just tell the media to fake the opinion polls and say she's popular. These few months after the presidential election, Tsai Ing-wen's approval rating was at 60%, when in fact it was actually 30% most likely. The way to interpret these polls is to subtract 30% from the official support rate. Then you can actually get the real support rate.
And Taiwan has been praised for its early action in this pandemic. Just talk us briefly through what authorities did.
The most critical measures to control the pandemic is that Taiwan has imposed very early border control. Like back in January, Taiwan has drastically cut off the flights between mainland China and Taiwan.
Well, I would argue that the Tsai Ing-wen administration did not actually do a good job handling COVID. We've already seen that they did not make masks readily available for the public so that they would have enough to donate to other nations as part of their international diplomacy to get people to think that they were great. Secondly, They did not test people at the borders. When passengers were coming in on flights to Taipei International Airport, for example, they were not being tested in Taiwan. This did not actually happen until recently, in 2021. So to contain COVID, it wasn't just about cutting off flights from mainland China early on. There were also many cases of COVID coming in from nations like the Philippines. They constantly reported cases coming in for the Philippines, yet they wouldn't conduct testing at the airport. The third reason why the Tsai administration was overrated was because they were against testing the general public. When local city governments wanted to conduct testing, the central government prevented them from doing so. The Changhua city government was punished when they tried to conduct general testing. Let's take a look at this Newslens article dated August 25th, 2020. Weeks of debate on whether Taiwan should expand its COVID-19 testing took a dramatic turn on Tuesday. The midterm report of a coronavirus antibody testing program involving 10,000 residents in Changhua, a central Taiwan county, was cancelled abruptly the night before its scheduled release. The testing saga has put Taiwan's much-praised coronavirus response under unusual scrutiny. The study, led by National Taiwan University's College of Public Health, would help determine the true community infection rate in Taiwan and provide guidance for future pandemic policies. According to Dr. Chen Chong-chen, professor at NTU CPH, since researchers launched the testing program in June, they have built up public anticipation and potential findings. But Dr. Chan cited incomplete administrative tasks as a reason for the last-minute cancellation of the Tuesday press conference. In a growing debate over Taiwan's testing capacity and quarantine policy, the Central Epidemic Command Center has had to fiercely defend its COVID-19 strategy against criticism from prominent public health experts and the opposition Kuomintang Party. Health Minister Chen Shizhong told reporters that the high-profile study has caused unnecessary arguments and urged researchers to explain the delay. He also indicated possible ethics violations in the program. As new outbreaks are emerging even in countries that had previously contained the virus, Dr. Chan urged Taiwanese authorities to conduct mass screenings on travelers arriving in Taiwan. When several foreign nationals returning to Taiwan tested positive for COVID-19 last month, he warned of a growing risk of the presence of asymptomatic carriers in local communities. There have also been at least 8 recent cases of travelers who reportedly tested positive for COVID-19 after leaving Taiwan. While most of these mysterious cases proved to be false positives after further investigation, they raise concerns over whether Taiwan may need to test more. Internationally, asymptomatic patients have indeed been one of the biggest sources responsible for the spread of coronavirus. Dr. Chun-Hui Chi, director of the Center for Global Health at Oregon State University, told the Newslens. That's if they're not being isolated, Dr. Chi said. But Taiwan has done a superb job, probably too strict, of putting every incoming visitor and citizen through a 14-day quarantine. He cited a recent controversy in which Changhua's health officials tested an asymptomatic student who was under home quarantine without approval from the Central Epidemic Command Center. While the student tested positive and was sent to the hospital, the test was totally useless from the viewpoint of pandemic control because he was still in quarantine, Dr. Chi suggested. More recent data indicates that a COVID-19 carrier, irrespective of symptoms, is the most contagious between the first day of infection and the 10th day, he added. If the student was asymptomatic, he would not have been contagious once he was out of quarantine. That's why Taiwan uses a rather conservative 14-day quarantine, Dr. Chi said. The Changhua Public Health Bureau is currently under investigation for violating CECC protocols. Several Kuomintang officials and public health scholars, including Chen, have criticized the CECC for overreacting. Chen said that the probe would help authorities understand any loopholes in the current testing policy, and that he did not wish to turn this debate into a political issue. While South Korea and Vietnam have taken an aggressive testing approach, Taiwan never adopted mass testing. South Korea, which is on the verge of a nationwide outbreak, has conducted over 1.8 million COVID-19 tests to date. Meanwhile, Taiwan has only tested slightly more than 170,000 people in total. Instead of mass screening arriving travelers, Taiwan implemented strict quarantine measures, which require 14-day home quarantine on arrival. Taiwan implemented strict quarantine measures, which require 14-day home quarantine on arrival, followed by a 7-day self-health management period. A robust contact tracing system has also helped prevent a major outbreak in the country so far. Currently, Taiwan only tests incoming travelers if they exhibit COVID-19 symptoms during the mandatory 14-day quarantine. Foreign nationals without residency are required to provide a negative COVID-19 test within 3 days prior to boarding their flight to Taiwan. Taiwanese nationals and foreign residents would have their specimens collected upon landing. Despite calls for mass testing, the CECC has repeatedly stated that this strategy is extremely vulnerable to false results and that it would overload Taiwan's healthcare system. However, the center is open to possible changes upon discussions and scientific consensus. As the prevalence of COVID worsens in some countries, the CECC may want to consider whether to test all passengers from select countries on top of the quarantine, said Dr. Tsai Ing-wen, a government professor at University of Texas at Austin, who believes that more testing could be beneficial under the right circumstances. What is important is not testing more for no reason, but testing smarter for good reasons. So I guess the summary of that article was, they just don't want to test. So of course Taiwan had very few cases of COVID because they refused to test. If they had tested, they would have found more cases. Of course that would have raised more public alarm, but it would have been better for the public because at least everybody would know about the actual situation in Taiwan instead of just trying to keep cases unknown and hidden. And when cases did pop up, when people left Taiwan and went to other nations, they would never admit that those people had COVID while they were in Taiwan. They always suggested that perhaps they got COVID someplace else, but not in Taiwan. This is why Taiwan had no domestic transmissions for several months. It was completely unrealistic. Any other nation with COVID being brought into it from the outside would have domestic transmissions over such a long period of time. Yet Taiwan had 0 for the longest period of time. You can see from about May 2020 to May 2021, Taiwan just had very few cases, and when it did have cases, they were almost always imported. It was almost as if Tsai had given the order that the Taiwan government doesn't have domestic transmissions, and we can see later on in June 2021 that there were almost all domestic transmissions once the so-called Delta variant came into Taiwan. So by late June, I had my second round of trouble with the Tsai Ing-wen administration over exposing them on YouTube. And I got called into the Criminal Investigation Bureau again. This time I brought a lawyer. By this time I was getting pretty sick of being in Taiwan. I just did not want to be in Taiwan any longer, and I was looking to get out for a while. I had been planning to visit Hong Kong that summer, but this incident inspired me to leave Taiwan immediately the next day. I just couldn't handle another interrogation from the Criminal Investigation Bureau. It was getting extremely redundant, and I was getting very tired of it. I had more videos to post, and I didn't want to be harassed any longer. It's really not fun getting interrogated and harassed by detectives when they're under orders from the Central Election Commission and Tsai Ing-wen directly. There was really no crime committed by myself, and they were not charging me with any type of a real crime. They just wanted to harass me because they don't like being exposed. It's extremely uncomfortable dealing with this kind of thing in Taiwan. So going to Hong Kong allowed me to experience their COVID prevention measures firsthand. The first thing you have to do is download this app. Then they give you this bracelet where you have to scan the QR code to prove that you are in your quarantine location several times a day when the app starts making noise. So we were brought to this holding center and we were tested with a deep throat saliva test immediately. This is what the testing area looks like, and those are the materials they give you. Doing the test is easy, but it does take a very, very long time to get the results, and the sandwiches they provided were not really the tastiest. It was really not a fun experience. So this is my hotel room that I stayed in for 14 days. By the end of it, I had pretty much had it. Now the first thing I noticed when I got out in the streets of Hong Kong was that you could buy masks very easily, boxes of them, almost as if they were toilet paper. So you could say that masks were very easy to get in Hong Kong, while they were very difficult to get in Taiwan at that time. It wasn't until August that someone sent me a picture of masks being sold in stores in boxes like this. Also, due to the fact that pork with ractopamine is banned from being imported into Hong Kong, there isn't this paranoia over pork sellers, whether the pork is really from Hong Kong or if it's from the United States. In Taiwan, the local pork industry has really suffered because people can't be sure if the pork is really from Taiwan or if it's from the United States. So for the first week in Hong Kong, I had a really great time, meeting up with some old friends, going to the comedy club. However, Hong Kong had an outbreak and things were pretty much over in Hong Kong. I had to stay in my hotel room again like it was quarantine. So I'd like to do a simple comparison between the Hong Kong SAR government led by Carrie Lam and the Taiwan government led by Tsai Ing-wen in terms of how they handled the COVID outbreak. Which side allowed for general testing without interference? Which side stocked face masks, making them easily accessible to the general public? And which side immediately tested passengers upon entering the nation, not once but twice during a 14-day quarantine? Which side prevented local city governments from doing general testing? Which side donated masks to other nations, depriving their own people of masks? And which side refused to test passengers when entering the nation? So my unpopular take on this matter is that Carrie Lam's Hong Kong SAR government actually did a better job of preventing COVID from entering Hong Kong than Taiwan in Taiwan, despite the numbers. Taiwan basically just stopped reporting cases unless they had to. That's how they kept their numbers low, while Hong Kong actually just reported their cases. You could say that this was due to opposite political agendas. In 2020, the Hong Kong government wanted to see the protests go away, while in Taiwan, Taiwan needed to justify her unimaginable 8.17 million ballots. So there you have it. In the Western media, Carrie Lam is villainized because of the extradition issue and the protests that occurred afterwards. But the truth is that she didn't deprive the Hong Kong people of their basic needs. Things like testing and face masks were all readily available in Hong Kong without issue. These kinds of basic needs were what were taken away from the Taiwan people so that Taiwan could have her day in the sun with the international media.